JM in the AM, it's our visit to the campus of the Touro College of Dental Medicine, and the dean of the Touro College of Dental Medicine is Dr. Ronnie Myers, and he is with us here on our broadcast. A pleasure to welcome you to JM in the AM.
Well, thank you for having me.
A pleasure to be here. And what a campus. I mean, this is, it's funny. I'm involved in the community for God knows how many decades at this point, and you think you know everything, but it takes the opportunity like this to visit a facility to see what's really happening. And this is absolutely beautiful in a beautiful area of New York. And the technology that you've established in this building is remarkable. It must be incredible to be at the helm of this operation.
Well, I can honestly say it's been a miraculous journey. We're now literally in our 10th year of operation. Wow. We've graduated 6 classes, soon to be 7. And I would say the birth of this institution has been quite remarkable, and the people who work here make it run every day. And having been in dental education for a very long period of time, seeing what can be accomplished in such a short period of time is really heartwarming and heartfelt.
How does one keep up with the academics and the technology in this industry? Because it does seem like in this, especially after visiting the simulation lab and the clinic, it seems like the technology in this industry is just expanding constantly.
Yes, I think that's a good point. Certainly, if you look at the spectrum of dentistry, let's say over the last 50 years, what has happened in the last 10 years has been remarkable. And the idea of bringing that to our students in a way that they have to learn the basics. Obviously, they have to learn the foundation and where we've been, but where we're going is quite remarkable, and we have the tools to do it.
Right, and you require multiple tools in so many different categories. I mean, from the printers that are making crowns to the computers that do other specialty work, and I'm sure there's a million things that are happening that I'm not even aware of, obviously. I don't know much about dentistry, but every one of them needs one of these specific technologies, and you need it to be provided on a multiple basis because you got so many students here.
Yeah, and, it's interesting because you don't know where the student's going to go when they leave here.
Right.
So they have to have a whole set of skills. If you went back, as I said, 50 years ago, the skills were pretty well maintained. And you knew that when a person left, whatever practice they would go into would probably have the same set of skills that we have given them. In today's world, because the technology is expensive and where they're going to go to practice may have different technologies available to them. So they have to be nimble enough when they leave here to not only know the foundations and how they can do things one way, but they have to know what else they've learned so that they can continue to grow.
Speaking with Dean Myers, Touro Dental here on the campus, is there a shortage of academics in this area? Can one hire a faculty in a dental school in the New York area and be confident that there's a good pool of people to choose from?
A great point. One never likes to think of ourselves as dinosaurs, but the reality of it is that a great many of the people who come to teach didn't grow up with this technology, and so therefore they have to learn it alongside the students. Right. But there are a cadre of individuals who are in the younger category who have, let's say, graduated in the last 10 years or so, or 15 years, who have obviously moved with the technology. So we have students learning alongside our faculty from younger faculty that have certainly taken this and moved forward.
And on the first part of your point, it's not every industry that takes people that are at the tail end of their careers and are able to incorporate them into a modern program. And it seems like it works here.
It definitely works. And I think that our spectrum of faculty really runs the gamut from those. We have faculty actually that graduated in our first class that have now come back to teach, which is really heartwarming because we need dental faculty, obviously, and we have faculty that, as you said, are at the end of their career, or they're end of their practice career, I should say, that they've left and now want to give back. And we can meld that, the clinical experience that they've had over 30 and 35 years is far more important, let's say, than the little techniques that they may have learned, but to how they interact with patients and how they've learned to hone their skills with these patients versus those that are at the beginning of their career.
Right.
They don't have that clinical experience to fall back on, but they do have the motivation to become better, and they're technologically better and more adept at learning these new things.
For the college students listening and for the parents of college students listening, what makes a good dental student?
What makes a good dental student? Well,
someone's a senior in college. They need to have what or think in what way in order to pursue this track?
I think one thing to be any healthcare worker, so let's put it on that category first.
Good point.
To be any healthcare worker, one has to have compassion, and they have to have empathy, and they have to be of sound moral character that is in it for the betterment of the patient. So that's one. Two, I think that they have to have the open mind and the critical mind to be able to be analytical. You know, students who come to dental school, everybody worries about their clinical skills, their dexterity. I would say the number of individuals who come to dental school that do not make it through dental school because of their dexterity is extraordinarily small. People who enter dental school, obviously they enter academically, they're qualified. We hope that they're personally qualified, that we've done good vetting in that regard. But the clinical skills, they will master
Right.
those. They will master those.
But bedside manner, they're going to have to work on. It's interesting on that point. Isn't it funny that the majority, if not all, of the training that they are getting, hands-on training they're getting in this building, are essentially, I don't know if you'll agree with this, but essentially with the underprivileged, with the financially challenged, with people who turn to your clinic to be a lifesaver.
Well, and we hope, although hope is not a great strategy, we hope that what they are learning in our clinical environment, yes, the technical skills, but they are learning healthcare disparities, inequities, individuals that don't have the wherewithal to go someplace else, that they learn that compassion, empathy, and moral compass that's going to provide the best possible care for these individuals. And again, we can teach everybody to do the technical, clinical, technologically advanced skills.
Right.
The other things come with time. And it is a big, important aspect to bring the human culture to that aspect of our education.
We talk about in the any independent or even involved observer of the Jewish community knows that dentistry is a very popular profession. I wonder if it's like that in general. Obviously, Touro, you're dealing with a diverse student population, right? It's not just our community, it's so many communities. And I'm wondering in general in New York and New Jersey if it is a densely populated industry. Is it not nearly as bad, maybe the wrong choice of words, as what I'm used to seeing in our own insulated community?
So I'm not sure where you go with that.
Are there too many dentists out there in this area? Or too many people pursuing dentistry, I should say?
So, let's think of it a little bit more broadly.
Right.
A more global question would be, are we producing too many dentists? Now, it is true in the educational dental world, there are new dental schools opening. The number of first-year matriculated students has gone from about 6,200 or 6,300 to almost 700 first-year, 7,000, 6,200 to 7,000 first-year students. So
that's what, nationwide?
It's growing nationwide.
Well, that's quite a number.
Well, let's put this in perspective.
Right, compared to the population.
Exactly. Right. So in 1975, there were about 15,000 applicants to dental school, 1975. The number of first-year students across the country at that time were about 6,000. The population in the United States was 210 million. So we were entering 6,000 dentists in the queue to become dentists for 210 million people.
Right.
Let's fast forward now to 51 years later. We are entering only 7,000. That's only 1,000 more dentists into the queue. And the population is 340 million. So the question would be, are we producing enough dentists? So the answer to that question is twofold. One is, we are producing enough dentists, but they're all going to the wrong place. So if you want to look at the Westchester, Manhattan area, you'd say there are plenty of dentists and the ratio of dentists to population is fine. If you go to Greene County in upstate New York, or you go to any one of 32 counties of the 33
you could be
in New
a
Mexico,
dental hero.
you could be, exactly. It becomes a dental desert. And it's one of the reasons that we went to New Mexico, is to try and make it so that maybe dentists will go where we need dentists to be.
And not that you're the dean out there, but the reality is that has not only been, I have to assume, for New Mexico, but it's really helped the entire Western region, I would guess, by attracting students from all over. Am I right or wrong about that?
Well, I would say that
is it really New Mexico centric? Like,
so
really?
We have a facility now, our clinical facility in Albuquerque. So we increased our enrollment here from 110 students in a class to now 210 students in a class. First 2 years, everybody's here. And then in the third and fourth year, 100 go to Albuquerque and 110 stay here.
Wow.
Now, why you'd say, well, why Albuquerque? New Mexico was one of only, at that time, it was one of 13 states without a dental school. Now I think that number is only 11, but at that point, 13 states did not have a dental school, New Mexico being one of them.
And that obviously means not enough dental clinics to serve an underprivileged population.
And if you look at the population of New Mexico, which is 2.2 million people, the dentist to population ratio in New Mexico is about 43 dentists per 100,000 people. The national average is 61 per 100,000 people. Again, if you look at the number of dentists, let's say specifically in Albuquerque, probably the percentage is not so bad. But as soon as you drive an hour outside of Albuquerque, assuming you're not going to Santa Fe, there's just not going to be enough dentists.
I'm glad you explained this, because now I understand the whole dynamic of these 100 students going out there and really serving the population. It's not that the school is serving the western part of the United States. It's that your students are serving a population that really needs you out there.
That's true.
And there are other states in the union that could use the same service, right? Not suggesting you should expand there. I'm just saying this is not an uncommon problem. Dr. Myers is with us, Dean of the Dental School, the Touro College of Dental Medicine, I should say. You got the big gala this coming Sunday night, and we spent a couple of minutes earlier on TouroCAREs. It's an unbelievable project. You know, I emphasized how your students, especially in their latter years, are dealing with patients of different backgrounds, and some of them really challenged on a regular basis in your clinic. And now you're really, to a degree, I know this is a new type of department, but you're expanding that in terms of serving a population who have great challenges in getting good dental care.
Yes, that's absolutely true. It's a project that we feel very strongly about.
I saw how much space you're dedicating to it, by the way.
Yes.
It's insane.
It's somewhere in the neighborhood of 5,000 or 6,000 square feet.
Right.
And
on the ground floor, by the way.
Yeah, on the ground floor, very accessible to ambulettes and walkers and wheelchairs. So the TouroCARES project, which is the Center for Access, Respect, and Empathy, is a facility that we're going to build that approaches the needs of the intellectually and developmentally disabled population, as well as others with special needs. This is a population that sorely needs access to oral health care. They need people who can actually care for them in the general community. And right now, there are not enough dentists who are educated in being able to manage them in their private offices. And they wind up seeking care in emergency rooms and hospitals, and they wind up on long waiting lists, and their minor dental problems become more complex.
And in general, the consumer doesn't love dental work. I don't know if you know that. Like, I was joking with the students that they start with 2 strikes against them because nobody wants to be there and nobody can take the pain, and everyone wonders in their head what's going to happen to them in that chair. And then you deal with people who are not able to sit still, physically can't sit still, or have certain disabilities, And these, and the problems are obviously, multifold. It's really an amazing project. I've seen this. I mentioned this earlier. I've seen this with my own eyes. I've seen specialists who are able to do it. And I know you're actually installing the capability of using sedation and anesthesia, which is amazing. And not every environment is allowed to do that. So the whole thing is just incredible. Anyway, Mazal Tov, congratulations on the big gala on Sunday night. And I hope it's a major success. And now I understand why so many people in the community like to support causes like the dental school, because this is a very, very impressive facility, and it looks like you're doing an amazing job. And thanks for allowing us to visit today.
Well, I truly appreciate the time, and thank you for all you do.
Dean Ronnie Myers here, the Dean of the Touro College of Dental Medicine. More coming up. You're listening to JM in the AM. We're at the Touro College of Dental Medicine, and the folks at Touro have been kind enough to bring a couple of students by so we could speak about the academic experience and the student experience here at the Touro Dental School. Aliza Silverberg is with us from Muncie, New York. Pleasure to welcome you, Aliza.
Thank you so much. It's a pleasure to be here.
Thank you for that. And Dovi Teigman, who now lives in Queens, New York, and is a student here, joins us as well. Dovi, a pleasure.
Thank you very much.
What years are we talking? Now, I know they told me that if you're in different colored scrubs, you're in different years, so you guys fit that perfectly. You are?
End of D2.
That's the second year. And you would be?
End of D3.
End of D3.
Almost there.
You're the senior fellow here among all of us. You're the one with the most dental experience. End of D2, and the reason I start with you is because we have already learned through our conversation with Dr. Katz that this is a really important transition time that's starting now.
Absolutely.
Because toward the end of D2, your second year, you're going to make your way into what's going to eventually be at the beginning of D3, your third year, actual work on actual patients. So tell me first about working with mannequins, with fake models when it comes to dentistry.
Sure. So, 2 days a week we go into SimLab, and they actually do a really, really good job of, I haven't been in actual clinics, so I don't know, but of simulating, the pressure that you may feel when you go into work on real people, and we're on timers, and we're really practicing all the procedures that we're going to be doing, whether that's fillings, whether that's, I
wonder how many procedures there are. And then I have to wonder whether I've had them all or not. Yeah. But there are many more than the average person would encounter in their dental life, right?
Yeah, hopefully. You definitely hope.
Hopefully is right. And I guess the only difference, and you'll address this for us, Aliza, in a moment. The real difference is the reaction of the patient. In your case, obviously, there's no reaction yet. Next year, you'll actually have to deal with people, feeling what you're doing and experiencing the entire thing. So what is that transition like? Because, you're now in the third year and you're actually working on real patients. Is it difficult to make that change where now you have to worry about the reaction and the feelings, so to speak, of the person sitting in that chair?
It definitely was a learning curve, I would say, just thinking about the tongue, cheek retraction, saliva. Sometimes there's blood involved, and that's not something that we're adjusted to before starting to treat real patients, or even just patient positioning. It's a lot easier to just shove the mannequin a little if it's not in the position that's most comfortable for you. That was definitely hard for me in the summer. I think that was more of like that transition period. Just learning how to position the patient where they're comfortable and I can do my job properly. I can see, I'm not injuring myself, and really focusing on, making sure that any soft tissue is out of the way of what I am doing to hopefully prevent any injury.
Wow. It's a lot you got to think about as you're doing all of this.
Yeah.
In the SimLab, I noticed that it was very 2026, meaning that the doctor, you as the trainee, as the student, are sitting behind the top of the patient's head. And I assume the same thing is happening where you are in the actual clinic, right?
Sometimes at
9
o'clock.
And the reason I bring this up is because, I know you can adjust and you can maneuver, but the reason I bring this up is because that was never the default in my day. Meaning, when I was a kid, many, many years ago, the dentist was always in front of you and always, doing whatever he had to do or she had to do on your mouth, from the, face-to-face standpoint. And this seems to be the new normal, right?
Yes.
And is it much easier? Is that the reason for it?
It definitely is more ergonomic for the provider, especially now. Most students in school and new practicing dentists are wearing loupes, like the magnifying glasses that we wear, which
Even
is not
the young
something.
people.
Yeah, but I've shadowed dentists from wide age range, but obviously superior to me, and different backgrounds, different schooling. And a lot of them were trained without loupes, and they might position themselves differently so that they can see better.
So magnifiers are very big these days, and specialty lighting is very big these days, because it used to be, that one massive light that was on top of the patient, which is blinding.
Right.
Now it's really pinpoint lighting.
Yeah, we have overhead lights, which is really nice.
Oh, not
We
attached.
have the headlamps also.
Yeah.
Yeah.
That's what I'm referring to.
Oh, yeah, that's what I meant. Sorry.
Right. I really meant the overhead. You're talking about the one attached to the head.
Yes.
Why'd you pursue dentistry?
Dentistry to me is fun. It's creative. It's artistic. I know not many people
Us
feel
patients
that.
have trouble understanding that. So you love what you do.
I do.
That's
I
the
really
greatest
do.
thing.
There's always more to learn. I love working with a team. I love that it's not just me alone. I have the patients I communicate with. You have your staff, your assistants, your hygienists. There's a lot of collaborative work between doctors also. You can refer for a root canal. You can speak with your friends and coworkers on how best to proceed with treatment. So it's really, you're not alone, which is really nice. And yeah, it's just always evolving. So that's exciting for me.
I mean, I only walked around here for less than an hour, but it seems like a pretty pleasant environment. I mean, you're describing, consulting with those who are more knowledgeable than you, or have more experience, et cetera. But it seems like there's a real camaraderie in this building. I don't think, I don't think anybody's putting on a show. It seems like that's the vibe here.
No, it's not a show. Yeah, it's definitely not a competitive atmosphere, which is really nice.
Why'd you pursue dentistry?
So, I mean, similar to Aliza, definitely that the collaborative atmosphere. We'll just talk about that a little bit that we have here. I have friends in other places, and I can tell you that this school really, from the top down, because that's where it starts, they listen to us, and they're responsive to our needs, which is amazing. Whether it's Yom Tovim or if someone has some family things going on, they're really, really flexible. So that's amazing.
They get the gist of our community.
Very much, yeah.
Lots of moving parts.
Yes. But in terms of why I went into dentistry, it was really, there's not like one specific factor, but it was more of, I love the sciences in general. And I like Aliza was saying, I love speaking to people, and I couldn't sit behind the desk, or I couldn't be in a lab. So I wanted to work with people, whether it be other providers or like your patients, and really help them. People come into the dental office many times just with pain. Right. And the fact that you can send them home and they're feeling better and they just have their life back, because dental pain could be really over-encompassing and debilitating. So I really, really like that about dentistry.
Speaking with Dovi Teigman and Aliza Silverberg, both students here at the Touro's College of Dental Medicine, I would assume that now that you're working in the clinic, you're dealing with a lot of underprivileged people. I mean, who's coming to a clinic? I mean, we know the realities. We know what the financial realities are in the world of dentistry. You walk into a dentist's office, you could be paying thousands of dollars for, for a typical procedure that's needed. So, do you meet a lot of people who have really postponed the need for dental work because of the situation that they're in, whether it's financial or just, they may be part of our society that just doesn't get an opportunity to take care of these things?
Unfortunately, yes, all the time. There are patients that come in and they say, I wish I made this a priority sooner, but there was so much going on in my life that it kind of fell to the back burner, or I couldn't gather the finances for it. I can't say with confidence all the ins and outs of how the school works with like insurance and, the payment and stuff like that. But I do know that it is a struggle for people, and that, like you said, that is why they're coming to a clinic. And we are definitely sensitive to that. We're not going to offer a patient who's struggling, full mouth of implants. Like, it's almost a slap in the face. So we really do try and listen to their history, to their background. We ask them, like, what's difficult for you to come here today, or in general? Is it transportation? Is it time? Is it money? Like, is it anxiety?
Sometimes
of those
all
things.
of them. Yeah.
Exactly. So we really do try and look at the full picture and come up with treatment plans that will feel comfortable for them, that they can.
How many patients can you see in one day? Like, you'll meet how many new people in one day?
It depends on if we're in our regular home clinic, is what they call it, or on a rotation. But in a typical home clinic day, the days that we start seeing patients at 8 a.m., we aim for 4, 2 in the morning, 2 in the afternoon. And then there are some days that we have a lecture at 8 and the clinic only starts at 9. So those days we see 3 patients, 1 in the morning, 2 in the afternoon.
So with all the practice you're getting, you have to be up to date on your academics as well.
Yes, I'm starting to study for my boards next week. So that's
When do those usually take place? What month?
I'm scheduled to take mine May 18th and 19th. Some people are taking them end of March, some in April.
How are dental boards considered? Are they considered very tough, impossible to pass? You need to do it a second time. Most good students could get it passed right away. How are they viewed out there?
They're challenging. The good thing about it, though, is that it's all information that we've already learned, the first 2 years of school. And a number of students have told me that they really did feel well prepared academically from our first 2 years, where we learned all of that information. And now it's really just review and repetition, practice questions, but the knowledge is there, which is really reassuring.
Well, very nice. Final question. Do either of you fear the number of people in our community that are going into dentistry, knowing that there are only a certain number of patients in the New York, New Jersey area, and there seems to be a large number of both male and female dentists in New York and New Jersey area? Does this ever cross your mind?
You can answer.
It's interesting. Didn't really cross my mind.
Is there work for everybody? Is there work for everybody out there?
I think there are many mouths to go around, definitely. I happen to plan on moving out of town, so...
for that reason?
Help. No,
Me
not
too.
for that reason, but...
You also?
Yeah, my family actually lives in Florida, so I'm hoping to go back there.
Wow, interesting. Because earlier with Dr. Katz, that was one of the pieces of advice he says he's giving students.
Mm-hmm.
There's incredible number of opportunities nationwide.
For sure.
If you get out of this very densely populated with both patients and dentists, who are in the New York, New Jersey area. Wow.
Also different specialties.
Right.
that would be the main reason probably why I would move out. I'm planning, hopefully, on specializing in orthodontics. So
Nice.
we'll see.
I want to do peds.
Pretty amazing. I thank both of you. Dovi Teigman and Aliza Silverberg, students at the Touro College of Dental Medicine. And continued good luck to both of you. Thanks for joining us
Thank
today.
you so much. Nice to meet you.
More coming up. You're listening to JM in the AM. JM in the AM, and we are at the Touro College of Dental Medicine, part, of course, of Touro University, and we are visiting with Vice Dean David Katz. Dr. Katz has been a guest of ours before here on JM in the AM, and this coming Sunday, the Touro College of Dental Medicine is going to be honoring and celebrating Dr. David Katz for his leadership and support of our community and the Touro College of Dental Medicine. The gala celebrating 10 years of excellence in dentistry with the Touro College of Dental Medicine is going to be happening on Sunday, February the 22nd, starting at 5 p.m. at the Rockley Country Club in Rockley, New Jersey. Information 914-594-2647. Dr. David Katz, good morning, and thank you for welcoming us to the Touro College of Dental Medicine.
Good morning and welcome. You know, your speaker, your listeners are really very fortunate people to hear you on a daily basis
Thank
for
you.
all these years.
Appreciate
It's
that.
a credit to everything that Yiddishkeit would like to project to the public. You personify. So
Well, I appreciate that very much. Let me take this opportunity to wish you a big mazel tov.
Thank you.
I hope you're ready for Sunday night. Is anybody ever ready for a gala?
You know what? It's not about David Katz. This is really about Touro College of Dental Medicine, and specifically about TouroCAREs, about
Right.
the project that we really want to project, something that we believe represents what Touro University is all about providing care to the underserved. And that's what we hope to do with TouroCAREs.
This is the first time I've ever been in this building. I'm in the dental school, so our listeners understand what's going on here. It is extremely impressive. I mean, first of all, the beauty of the building is incredible. That's number one. And it does seem whenever Touro does something, they do it right.
Thank you.
Yet another example, right? That seems to be in their DNA here.
We're very fortunate. We're blessed with a really good leadership, and that has the foresight to understand what where things are going. There's a saying in Hebrew, "Ezu chacham haroas hanolad,"
Right.
and they just understand that.
It's pretty amazing. And then I got a little bit of a tour and saw the student body and a diverse crowd, lots from our community and representative of really the entire area, it seems. And then in addition to that, I don't know if we call them, what do we call them, laboratories? I know there's a clinic here, but I'm talking specifically about where the students were practicing, the first and second year students
The
were
simulation lab.
Simulation lab. And that is an extremely, I can't even imagine what that costs to build and how complicated and technologically advanced it is for these times.
It is. When the school was established, we had made up our minds that we were going to try to be one of the most advanced institutions in the United States. And in fact, one of the perks, one of the reasons that I'm here and what attracted me was the fact that the challenge is to stay current and to provide the most current and advanced educational tools to our students. So that's one of the things that I enjoy most, and we deliver the goods to our students.
Yeah.
So we're constantly updating.
So you came here after a pretty robust career.
I was a clinician. I ran a residency program, but I was a clinician in a group practice.
Right.
And I got recruited to come here.
Well, and what a move it's been so far. So I saw in this simulation lab, first and second year students, how does one prepare as a student in college to go and make that leap into the first and second year of dental school?
I'm not sure if there's a tremendous amount of preparation other than know what to expect. So you should be working on some sort of development of skills with your hands, whether it's with pottery, with building things. You just want to develop a little bit of hand skill. As far as the technique and the knowledge, that's our job. That's on us.
Interesting. So, I mean, those who participate in athletics in high school and college, do they have an advantage, especially if they were involved in certain sports?
If they have hand skills,
Right.
I would say yes.
That's pretty interesting. Agility in their hands.
Yeah.
And is that something that becomes obvious right away? I mean, are there students here who you're saying to yourself, boy, oh boy, they don't understand or realize that they don't have what it takes to physically do this?
You know, it's interesting. There are students that are slow developers, but most of the time they really come
They pick
around.
it up.
They pick it up. It's just sometimes people pick it up at different rates.
Right.
And shockingly, when you think about it, there are fields within dentistry that make allowances for not having the hand dexterity and skill. So, for example, if someone realizes somewhere along the line that they just can't cut it with their, you like the pun on there,
Right.
but if they feel that they just don't have the hand skills, they could go into research or academics. So there are different venues for people who just don't develop those skills. But I would say 99% of the students do develop the skills.
And the students that I saw, once they finish their second year, they're literally then put into the clinic. Like they're going to see real patients and real life dental situations once they start their third year.
Students are put into the clinic already in the middle of their second year.
Wow.
They don't see patients yet, but they're working in the clinic on mannequins. And
that's in this building.
in the building. I can take it down. I'll show you later. And in June of their second year, they're thrown in full blast with patients.
Wow.
Now, mind you, understand they're never left by themselves. We have one of the most robust ratio of faculty to students in the United States, and we've adopted a teaching methodology where students are paired together. A D3, which means that a third-year student is always paired with a fourth-year student, and they work together. So the third year, when they're introduced to clinic, they're not working by themselves. They have a mentor right next to them.
And somebody who's got, many months under his belt
Yeah.
at that point already.
Yeah.
What is the dental honors pathway at Touro?
Oh, that's a program. That's a wonderful program we started about a year or two ago. Students that are interested in dentistry who have that feeling already in high school, if they're of a certain level, can apply to dental school out of high school. And if they hit the metrics and after an interview, we feel that they would be a good candidate for dental school, they are pretty much accepted into the dental school. As long as they hit certain metrics in college, they go straight into the dental school.
Is there a precedent for it? Is this?
This is a new program that we started. I think it's one of a kind, and they save a year of college. So in other words, their fourth year is the first year of dental school.
Right. So traditionally, I remember there was like a 6-year medical school program years ago. This
Correct.
is sort of a takeoff on that.
Takeoff of that. It's exactly right.
Wow. And then is it easy to identify high school students who have these abilities, or it's all grade based?
No, that's why we have the interview as well.
Right.
And obviously, it also depends upon certain behavioral patterns in college. We're very, very into ethics and morality. When students start the dental school, they all sign an honor code for professionalism and ethics. We stress it a lot. We have a course in the entire first year on ethics. We will never have failures from academics. We will support the students to the nth degree. But the most important thing that we try to create here is a mensch, a person who has honor, professionalism, and ethics.
No matter what their background is, no matter where they're from.
We say no matter what. That's when you walk through the school later, I will show you the room and that large lecture hall, and every single class that has gone through so far, it's a blown up honor code that everybody has signed. Wow. So we believe very strongly.
Dr. David Katz is Vice Dean of the Touro College of Dental Medicine, being honored this coming Sunday night at their big gala. All right, let's talk about the Jewish community. You know the audience you're speaking to right now. It does seem to me, as an outside observer, that there are a lot of members of the dentistry industry in our community. Is there a glut, a proliferation? Are there really a lot of dental practices within our community, and maybe we've hit the limit? How would you describe it?
You might argue that it's a very sensitive.
Possible, huh?
It's a very sensitive topic right now.
Meaning, because so many still want to go into dentistry from our community.
That, and there's going to be another school starting, so it's a limit to how many dentists are produced. Yes, it's a consideration.
And how many patients are?
And but it doesn't mean you have to necessarily settle in the and specifically in the New York metropolitan area.
Right.
One of my former students called me about 3 weeks ago. He asked me about a particular dental issue. We stay in touch with our alumni. We have a terrific relationship. And he asked me how I would handle a particular problem. I said, well, why don't you ask your father? Your father should be right next to you. I thought you went into practice with your father. I don't want to say what city, but it'll give it away. And he said, no, I decided to leave this metropolitan area town. I said, why? You had your father's practice. You grew up over there. He said, it's too congested. I want to go out on my own. I said, where'd you go? See, I don't want to say we're in the Midwest.
Right.
He went to a Midwest in a small town in the Midwest. I said, are there from people? I says, yeah, we have 50 to 100 people. I said, and he says, I love it. So I said, patience? I said, there's no shortage of patience. So there is opportunity. For example, we opened up a school in Albuquerque, New Mexico. Now, in the class of 100, this class of 100, we have 3 from kids there. Whether they stay or not, I can't tell you. By the way, it's all it's all kosher. When Touro does something, we do it right. It's all kosher down there. But whether they stay or not, I can't tell you. But there is such a shortage of dentists in New Mexico. If they establish a Jewish community, and we do already have a Chabad there, the sky's the limit.
Interesting. So it's really, whatever impression I have, and many people have, it's really limited to this area.
Yeah.
New York and New Jersey have a lot of Jewish dentists.
Correct.
And they're opening up practices or joining other practices. And
if you go to Montana,
you'll have a job.
Exactly. You go to New Mexico.
You'll be able to open up your own place.
That's right.
You mentioned earlier that this coming Sunday night, one of the things you're concentrating on, and really you said it's the focus of the funds that are being raised, is for TouroCAREs. What is TouroCAREs?
That's the Center for Access, Respect, and empathy. It's for the intellectually challenged and the physically challenged of our population. You know, there are people who in the world who talk the talk. Touro talks the talk, but they walk the walk also. This is a program that we really believe is providing care to the underserved. That's why I allow myself to be honored, because I'm a tremendous believer in giving back. And this is, I think, one of the greatest forms of tikkun olam, making the world a better place. So this is a part of society, a group of society that are probably the most underserved and underrepresented in the entire United States.
Not financially based,
Not I'm talking about
disability
care,
based.
right. They cannot get care in a private practice or in most clinics.
And that's because most of the professionals are not confident that they can actually serve them.
Or capable of doing so.
Right,
It's a lot of
because
these, think about it. Someone,
physical disabilities.
right, to his, a person oftentimes will have to be put to sleep in
Right.
order to do it. Severe autism,
Right.
severe physical
Not able
disability.
to sit still.
Exactly.
I mean, dentistry, you need to sit still.
I once, many years ago, when I first started, I had to treat a young man with cerebral palsy. He had such a severe case. He was in a chair, but his head was turned 3/4 backwards. In order to receive care, he had to lie on his stomach. Okay, just imagine for the average dentist to try to deal with that. It's not an easy thing, and especially with the legalities of sedating or putting people to sleep in an office, you can't do so.
Right.
This center, we are building operating rooms that are hospital grade operating rooms and sedation rooms and special needs rooms.
So you'd have real
Specifically-
anesthesiologists there.
Correct. Specifically to take care of this
Where is
population.
this facility?
It's down below.
Literally in this building.
We're going to be building it. We have a 5,000 square foot facility that we're trying to build.
So if the clinic is receiving God knows how many patients per week, you'll have the same type of reaction.
There is going to be a waiting list.
Yeah.
Absolutely. It's going to be one of a kind. There are a few in the immediate Northeast.
And which
but they're-
professionals will you use to do all this? Will you train them here?
We are training them.
That's
we
a
are-
specialty that's going to be.
Absolutely. We have a few people that are already trained, and we will continue to do so. We actually have 2 of our grads who went into this particular field.
Yeah. So I saw this live and in person at a clinic. It's very possible it was your students, frankly, who were doing it. It was in Brooklyn, New York. It's very possible that it was, students from here. And I saw the difficulty. I mean, look, dentistry in general, from the standpoint of the consumer, is very tedious, very painful, even if it's not really painful.
you're right.
Psychologically,
You're
it's painful.
absolutely right.
And it's one of the experiences that nobody wants to go for. You start with 2 strikes against you. You know what I'm saying?
You're absolutely right. When I was in college and I was trying to decide on a career, I remember going to my dentist, and afterwards, someone of my friends said, David, don't you hate going to the dentist? And I remember thinking about my dentist, and I said, I don't love going to the dentist, but I certainly didn't hate him. He was a nice guy. I thought to myself, well, if I can go into a career that people really have that feeling of fear and make them feel like I did, where I didn't fear him, I didn't love going, but he was a nice guy, and make it somewhat comfortable, I'm going to do okay. And that really, to a certain extent, that's one of the aspects of education here, is to try to have the students learn to make patients feel comfortable.
Right. Yeah. Well, I had a different experience growing up because I'm on the young end of an old family. I have a sister who was born in 1948. So we were going to dentists, even those of us who were born in the 1960s. We were going to dentists who were in their prime in the 1950s. And I hate to describe to you what the equipment was like.
I remember.
And by the way, one other tie I'll have on that generation of dentists, and I always say this to my kids, you know that today when they fill a cavity, they actually numb you?
Yeah.
Do you know that in my day, as a 9, 10, 11, 12-year-old, I never received Novocaine for anything? It could have been the most severe cavity there was. And people don't believe me when I tell them this.
I remember that too.
When was that? When did that change happen, by the way?
Local anesthetic became fairly
80s?
regular in the late 60s. It became fairly regular.
But not for a dentist like mine, whose prime time was in the 1950s. Understood. Dr. David Katz is here. So there's a lot going on in this building, on this campus, at the very same time. You're developing skilled people in specialty areas like you described. And by the way, dentistry itself is specialty. I walked into the simulation lab, and I'm saying to myself, they are really getting the experience of being an actual dentist. They are practicing on models, mannequins that are, as close to regular human beings as you can get.
Correct. And by the way, they simulate exactly the same equipment that we have down in the clinic. So it is very little transition. But you should, when you think about it, you're talking about the beauty of the school itself. But if you turn around, you'll take a look. This is all part of our campus. This is all part of the medical campus. So we're part of the medical school, the nursing school, the physical therapy, the physician's assistants, and we have those students interacting with our students as well.
It's all happening right here. Everything you just mentioned is right here.
It's all huge campus. And if you don't realize, maybe there's a tremendous interaction as well socially, which is a wonderful thing. So we have a daily minyanim. We have daily shiurim. I mean, it's just remarkable when you think about what I didn't have and what we're trying to provide to the students. So over lunch, we have lunch and learn usually at least once, twice a week. I mean, it's
amazing.
As my father, may he rest in peace, would say, it's gewaltig.
And, of course, the last thing we have to discuss is that it's ironic that you and I get together this time of year, because it's this time of year that your expertise when it comes to dentistry and halacha is really on steroids, because there are shilas that you deal with all year round, and there are many shilas, including what to do on Shabbos in dental emergencies, which you have contended people generally, and rabbis need to be educated about this, don't realize how severe and how much of an emergency it is when you have a dental emergency on Shabbos, and how it has to be dealt with immediately in many cases, in most cases, I would probably argue. But this time of year, as we get closer to Purim and Pesach, your favorite holiday, people are always...
It's all about kashrus.
Are all about kashrus. At Pesach, they come up with stuff that you think is completely crazy. And then you, because of your expertise in the Judaic academics, prove to us that there are poskim from years ago, Rishonim and Achronim, who actually dealt with these shilas. They sound like crazy shilas for Pesach, dealing with dentures and teeth and mouth. But you come across and tell us that they actually were dealing with them.
Halacha doesn't change. The application of halacha can be modified based on circumstances and changes of mitzias.
Right.
In fact, they had a terrific medical ethics conference last week. You probably heard about Chemed.
Sure.
So I was humbled to be invited to speak there. So I spoke on Thursday night, and actually it was the first time they had a dental subject. In fact, it went so well. We said, we're booking you next year. I said, my pleasure. but there is a lot of dental halacha that's mixed with medical halacha, and it's most of the time there's a precedent in halacha that we just have to find the application.
Right.
So.
And you become the expert at doing that. Well, Mazal Tov on Sunday night. Dr. David Katz being honored at the Touro College of Dental Medicine Gala. It's happening this Sunday at the Rockley Country Club in Rockley, New Jersey. Information, you can go to touro.edu/dental.touro.edu/gala or call 914-594-2647. And I appreciate you welcoming me here today.
Thank you very much for coming. I apologize for the hoarseness of my voice. I've been speaking a little bit too much this week.
Too many conferences. Simple as that.
Yeah.
Dr. David Katz here at the Touro College of Dental Medicine. More coming up. You're listening to JM in the AM.